Hello, everyone. Thanks for joining Tebra Talks today. My name is Kevin Clinton. I'm the Director of Marketing for Billing and Payments. And I'm joined today by Laura and Megan.
Hey everybody, I'm Laura Araya. I'm one of the product managers for billing. I'm focused on the front office and mid-cycle workflows.
Hi, I'm Megan Jernigan, and I'm a billing product manager for Tebra as well, focused on back office insurance collections and payment posting.
And thanks, team. So today's episode is denial proof, how Tebra is protecting revenue with clean claims. And we thought this was an important topic as claim denials are one of the biggest threats to practice revenue today. Whether it's a small coding error or missed attachment, every denial creates extra work and delayed payments for customers. That's why this episode is all about clean claim rates, what it means, why it matters, how Tebra is helping practices submit claims right the first time. And so we'll be running through insurance eligibility, code scrubbing, claim attachments, claim status tracking, accurate reporting, and then we'll touch on AI and the future of denial prevention. We can kick it off with the cost of denials and why clean claims matter. So Megan, what does a clean claim rate mean? Why is it a critical metric for revenue success? If we could start out there and dive deep a little into that.
Yeah, absolutely. So a clean claim rate just means how many claims you're sending out that are being accepted and processed by payers without being rejected or denied on the first submission. It's a critical metric because of a high clean claim rate leads to faster reimbursements, fewer rework cycles, and reduced administrative cost, all which directly impact a practice's cash flow and revenue performance.
Very important. So what would be some of the common reasons like a claim did get denied?
I think some of the most common reasons why we're seeing denials are usually around patient eligibility not being verified. And this can happen for a few reasons, such as not checking eligibility before the patient's visit, or even when the policy is being entered in and something's entered in incorrectly. Another top denial reason we see is due to missing or invalid prior authorizations. More than likely, the authorization was not obtained before the patient's visit. We'll also see timely filing denials as well. And this is a tricky one since all payers have different timely filing limits. It's important to check with your top payers to make sure those guidelines are clear and shared with any of the team members responsible for billing claims.
Wow, complex. So it's important to get the information right up front and it affects revenue. So how do we see that affecting small practice versus large healthcare system?
Yeah, I can think of that impacting smaller practices in a number of ways, but the one that sticks out the most is that smaller practices typically have only one or two billers handling all of the revenue cycle functions. Their time is spent between different priority tasks, which may limit their ability to follow up on denials promptly. Whereas with larger health systems, they usually have teams of individuals dedicated to specific areas of the revenue cycle, such as teams dedicated to posting payments or following up on outstanding claims. Denials hurt everybody, but in small practices, they can mean the difference between profitability and loss. That's why proactive denial prevention, like front end eligibility checks, proper documentation, and timely appeals, is even more critical in the small practice environment.
Okay. What does the ideal future look like if we get this right?
Yeah, if we get this right, the future of denial management becomes less about reacting and more about preventing. So, with AI and automation embedded in the revenue cycle, we can flag issues before a claim is even submitted. This means billers can shift their time from the manual rework to higher value activities like staying ahead of payer policy changes and improving documentation practices. Ultimately, both small practices and large systems benefit by reducing administrative overhead, accelerating payments, and creating a smarter, more proactive billing environment.
Got it. Okay, so pretty important to get information right, how it affects large organizations versus small practices. But I want to kind of shift gears and talk about catching issues before they happen. So, Laura, why eligibility is kind of the first line of defense in preventing denials and how that works.
Yes, Megan mentioned eligibility is one of the top denials. So it's super important because this is where the revenue cycle journey begins. It's really the most effective opportunity to be able to prevent future headaches. You don't want to build into a shaky foundation. You want to start the process right the first time as much as possible. So having or checking eligibility beforehand, it's very important in order to be able to have an accurate financial conversation with your patients. Make sure that they understand how much they will have to pay, and be able to collect the patient responsibility up front as much as possible, and also avoid to provide services that are not covered. All of these will allow to submit clean claims the very first time. And this is very, very important for practices to avoid denials, be able to become more proactive instead of just being firefighting reactively.
And what challenges do we see when eligibility checks aren't run?
We normally see an increase in denials, as Megan mentioned. If you don't check eligibility, you might be providing services that are not covered, and that will translate directly into a denial. That would be very hard to get money from an insurance. It won't be possible. And then you'll have to transfer all of that to patient responsibility, which sometimes can be tricky to get all of that payment if you didn't have that conversation with the patient beforehand.
I see. In terms of eligibility, how does Tebra help practices verify coverage and accurately and on time?
So on Tebra, we have the possibility to check eligibility real time. You can just go ahead, update your patient information into the system, and run a button that will allow you to know if the insurance that was entered is covered or not, or if it's active or not. Also, we provide a eligibility report where you can go and check specifically which are the for example, the copay, the coinsurance, or the deductibles that that patient has, which will allow you to make decisions in order if you want to provide a service or what conversations you want to have with the patient beforehand. So it's very clear who has the responsibility of the payment, which will allow you in the future to be able to move the patient responsibility faster and get the patient to pay if you have those conversations beforehand.
Yeah, that's pretty great. I know code scrubbing is part of the process, for stopping errors at the source. So maybe you could talk to us about coding errors, kind of what's the most common in denied claims.
Yeah, we do see a lot of coding errors. Some of them are kind of some recurring. We see the most is lack of medical necessity, where we can have diagnosis codes doesn't sufficiently support the procedure code bill. We could also have incorrect or missing modifiers. This is very important for certain payers that they specifically need certain modifiers in combination with the procedure codes being specified. There's also bundling or unbundling issues that are common as well, where you can have services that should be inclusive or not, or billed separately. And then there's also other data entry errors, for example, outdated or retired codes that are ICD or CPT that are already inactive, but providers might still be using them, which will generate coding errors at the end.
I see. I see. And for Tebra, how does our code scrubbing work here, and where is it built into the workflow?
Yeah, we have a partnership that allow us to do code scrubbing. These include checks around NCCI edits, medical necessity guidelines, bundling errors, and modifier requirements, as we mentioned before. In the system, as you enter all your information of the charge, you can just go click a button and right away you will get a response if all your codes are correct against all of these rules or not. And you can act just immediately. This will allow you to prevent future denials or rejections due to having incorrect coding.
I see. And what about for like maybe a specialty that has more complex coding requirements, like not your standard?
Yeah, there are specialties or certain scenarios where you need more fields. For example, if you're using drugs, you need to specify NDC. Sometimes you need to use reference codes or line notes, or you just have to do a bunch of overrides for the practice or the practice billing information. So we support all of these complexities. So you just have to add them into our charge form, and from there you can basically support any of the different needs.
So what have we learned from customer feedback regarding code scrubbing and the impact of?
For us, customer feedback is very, very important. And one of the first things that we learn is that they want more proactive guidance. They want the system to think with them, not just kind of reject and deny. They want to understand a little bit better why things might get rejected or denied. And they also want to understand how to fix it. They just don't want to be told, okay, this is what failed. They would like to have uh, steps on how to fix all of these issues.
So not just what's wrong, but what's wrong and how to rectify it in the future. Okay, on the claim attachments. Again, when are claim attachments required and what happens when they are missed?
Yeah, so claim attachments are usually needed when further supporting documentation is needed to justify what is being billed on the claim. We see this with unlisted codes and also on moderate to high complexity evaluation codes. And if the supporting documentation is not proactively sent as a part of the initial claim submission, the payer may just flag the claim, hold on to it, and then send a medical records request back to the practice. Once that's received, the practice or biller can then provide the documents that support medical necessity via fax, email, or payer upload, depending on what the payer supports. If the claim needs to be resubmitted, then you can just attach the documents to the claim and resubmit them together.
Okay, so you're looking at rework and then possibility of
Yeah.
delayed revenue as well. So what makes claim attachments tricky, say for like a higher volume practice?
I think the volume of patients alone is the tricky part. This is sometimes not a simple task, and it may require a lot of printing or downloading to make sure that you're getting everything that's needed. There are sometimes teams of billers dedicated just to fulfilling medical records requests.
Wow, so Tebra's done a lot to improve the workflow for submitting attachments.
Yeah, absolutely. So Tebra has significantly streamlined the workflow for submitting claim attachments. We now support attachments for over 200 commercial and government payers, allowing supporting documents to be submitted proactively with the initial claim, eliminating the delay of waiting for that medical records request. For practices using our clinical solution, provider notes can be accessed directly within the billing application, making it easy to attach that documentation without the downloading, printing, and switching systems that I mentioned before. This integrated approach helps to ensure cleaner claims and reduces the risk of the downstream denials and supports faster, more accurate adjudication.
Okay, that's awesome. So it's quicker and possibly gets you paid faster with less denials. Let me ask you, what's coming next to kind of help streamline that process even further?
Soon, users will begin receiving proactive alerts when claims are likely to require supporting documentation, first starting with moderate to high complexity EM codes. This allows billers to include necessary documentation upfront, knowing that these claims are more prone to payer scrutiny. In addition, we're enhancing the documents by enabling billers to filter documents specifically associated with a patient on the encounter. This eliminates the need to search by document name or scroll through the full document library, making it significantly faster to locate and attach the right files.
So essentially, we're suggesting or recommending when a claim might need an attachment to customers. Let's talk about claim status and reporting, kind of closing that loop. So talk to us a little bit about why tracking claim status is so important after the claim has been submitted.
Absolutely. So it's important to track the status of a claim after it's been submitted because, as I mentioned before, each payer does have timely filing limits, and you want to make sure that the claims are received and adjudicated within a reasonable amount of time for your payers. So it's important to just make sure that you're keeping on top of where your claims are at and making sure that none of them fall through the cracks because all of this can have a ripple effect to your incoming revenue.
Super important. So today, how do practices manage that claim follow up? And maybe you can highlight some key areas where they get stuck or hit obstacles.
Yeah, absolutely. So today, claim follow-up is primarily managed within Tebra at the track claim status screen where billers filter by claim status. And while this provides visibility, what I'm consistently hearing from billers is that the follow-up process still remains highly manual and time-consuming. One of the biggest pain points is contacting payers directly. So if the claim status isn't available through the self-service tools, speaking with a live agent becomes necessary. But even then, agents typically limit the number of claims they'll discuss per call, forcing billers to repeat the process multiple times just to get updates. The inefficiency makes it difficult to manage large volumes of outstanding claims and slows down the whole revenue cycle.
Wow, that's interesting. Only allowed a certain number of claims to talk about per call, which definitely increases the workload. What reporting tools does Tebra offer today to monitor denial rates, rejections, resubmissions, that sort of thing?
Tebra offers several reporting tools to help practices monitor denial rates, rejections, and resubmissions, ensuring they're staying on top of the billing performance. First, our reporting dashboard provides a clear snapshot of billing accuracy, so practices can view the percentage of claims rejected or denied within the past 30 days based on the total claims that they've submitted during that period. We also offer a denial summary report, which highlights the top denial reason codes by dollar value, making it easier to identify and address the most costly denial trends. Additionally, billers can assign follow-up dates to claims and use our new insurance collections report to track outstanding claims and ensure timely follow-up. This helps prevent delays and keep the revenue cycle moving efficiently.
That's right. Something to stay on top of, and we have the tools to do it. Now, let me ask you, how do we help practices going from being kind of reactive to those types of scenarios to more of a proactive approach in the billing process?
Definitely. We help practices shift from being reactive to proactive by equipping them with the insights needed to prevent issues before they occur. So, for example, like I mentioned before, the denial summary report can highlight the top denial trends, such as eligibility issues or missing prior authorizations. And with this visibility, billing teams can adjust front end workflows to ensure the necessary information is captured before the patient is seen or even before the claim is even submitted. So regularly reviewing these reports help practices ensure that all parts of the revenue cycle, from front desk to clinical to billing, are all aligned and working together rather than operating in silos.
Awesome. Thank you. So now I want to move on to a topic that's kind of been front and center. We're seeing more and more of is AI and the future of denial prevention. I'm hearing AI moving closer and closer to being integrated into kind of billing workflows and how we're dealing with denial prevention. But first, maybe we could start out with Laura framing up, talking about RPA and AI. And maybe you can kind of delineate or show some of the differences between RPA and AI, because I think sometimes those get confused.
Yeah, sure. So RPA, which stands for Robotic Process Automation, is basically just a digital robot that can automate repetitive and rule-based tasks. It's like giving them a recipe and they will follow it up to the rule. But with AI or artificial intelligence, it's more about something that can think and learn. They can interpret unstructured data, they can identify patterns, make predictions, understand context, and learn from new information. So they're not just following rules that are given to them, they can understand patterns and things that change and then learn from it. So there is quite a big difference between RPA and AI.
So you got the RPA, rules based, constrained, AI evolving, constantly learning. I think that's an important distinction. So if I can ask, where's AI starting to show the most value when it comes to denial prevention?
Yeah, so denial prevention is a perfect place to incorporate AI because we have ever changing rules from the payers. So it's too hard to create just a rule set because these change all the time. So it's extremely hard to maintain it. So with AI, we can actually identify the patterns. We can identify when a payer is actually changing rules and be able to react immediately without human intervention. So without a human telling them, okay, this rule is changing, AI can actually understand that a rule is changing because they can identify that a response is changing. So they can modify their own rules or how they work, and they can react to these and identify that denial might be coming quite fast, more than we could be able to do it with humans.
It's pretty amazing. So it's kind of clearing the road, if you will, but making it much easier to shift on the fly. That's great. What does the future of denial prediction look like here at Tevra? What's the vision?
Yeah, so we're looking to be able to support a very adaptive system. So what we're looking for in Tebra is to be able to incorporate it as part of the claim submission process. So before being able to submit a claim, you could be able to run this process, or this process could run automatically and be able to identify if the denial is going to come or not with certain percentage of accuracy. This is actually almost possible right now with how the technology is going, but in the future, we would like to even see how AI can actually correct a claim as well, not just indicate if it's going to be denied, but also can AI autocorrect the claim and have the builder be able to focus on other stuff.
That's incredible. So it's flagging the denial, making the change for you. That's great. And let me ask you, how can AI help practices kind of prioritize that claim work and reduce the manual follow-up that is typical? You mentioned that, the number of claims per phone call earlier.
Yeah, I think we're going to be seeing AI being incorporated in almost all of the RCM workflows. AI is going to be very helpful to be able to prioritize correctly, be able to make sure that we focused on the claims that have more high value, that have more potential revenue. Also, I think we're going to see AI being able to activate triggers. Like I mentioned for denials, not just call out the denial itself, but also autocorrect and say how to fix things and fix things themselves. I'm probably not going to get to 100% no builder, but we can really have builders be focused on things that have the most value and have AI be able to work most of the things that kind of get repetitive and be able to identify these patterns.
It's pretty amazing. It's like your smart assistant taking care of all the things so you can focus on more high value activities. That's great. Well, Megan and Laura, thank you so much for the time today. It was very enlightening. Just to recap, the denials are preventable and clean claims are the key to protecting revenue. So if you're a customer, ask about our claim scrubbing, eligibility, our new claim attachment tools, and looking forward to the future of clean claims with Tebra.
Yeah, thank you, Kevin.
Thank you.